Stephen is on The Money Show.
6 to 8
A
p.m.
lot of chatter about the NHI again over the last few days. First, the ANC and the DA said there'd been some kind of, I suppose I should really call it truce over the NHI, which would see a ministerial advisory committee of some kind being set up. Then both parties confirmed that the new system would allow medical aids to continue. But the Health Minister, Dr. Aaron Motsoaledi, then said he doesn't know anything about the deal. And as far as the NHI Act is concerned, he pointed out there doesn't appear to be space for medical aids. Thoneshan Naidoo is the CEO of the Health Funders Association. Thoneshan, good evening. Thanks for your time. I mean, from what you know, what is the state of play? Is there now suddenly, again, room for medical aids under the NHI?
Sure, thanks, and good evening to your listeners. So, thanks, Stephen. I think we actually a little bit in the dark. What we hear about and read about is, in the newspapers, and there's tremendous amount of speculation. So it's difficult for us to comment one way or the other. What I can say, which is in front of us, is the NHI Act is brought into law. It's the definitive measure by which we have to follow. And, that's currently on play. So it brings major changes. And until such time, either that's changed by Parliament or by a court of law, it still remains a law. And we're not clear on what the Ministerial Advisory Committee will do or don't. We're not aware of the terms of reference or who's part of it yet.
Okay, so unless the law is changed, there's no space for medical aid.
Yeah. Fundamentally, I think the law is quite clear in terms of Section 33. It states that once NHI is implemented, medical schemes will only offer complementary cover or top-up cover. But the concern there really is there's no clear timeline. We don't know yet what the NHI benefits package will include. And for that matter, then what will schemes actually be allowed to cover on top of that? So for us, we view that there is no current existence of medical schemes in the way we know it today.
Sure. You're obviously going to court on this. Many organizations going to court on this. Are you confident that these cases will stop the NHI, or let me be clear, the NHI Act in its current form?
So we can never be certain, in the ways when we go to court. And I think this is why we have a judicial system. I think going to litigation will actually set a better act, potentially set aside. But in the end, we believe, the proper justice will be served. We hope, that our side of the in terms of how we view NHI and what we propose and many others will show its light and hopefully set aside Section 33.
Thoneshan, I'm sure you know this. There are plenty of people who hate their medical aids. They don't think they're getting value for money from their medical aids. I suspect that one of the reasons that the NHI has gone as far as it has is because people feel that they're kind of being ripped off. And whether they are or not is a different case. They feel it's something they have to have. How do you respond to that? It's quite an intriguing point in this argument. And I think it's a strong argument coming from people who propose an NHI, that for a lot of people, a medical aid feels like a ripoff.
Sure. And I must say, when I was in my teenage years and just started off working, I also kind of felt like it was a grudge purchase. Why? I'm young, healthy. If I get knocked by a car, I'm going to be fine. We kind of had a sense of immortality. But, that's exactly what NHI, that's exactly what medical schemes are there for. They are actually there as risk insurance, so that when you actually get injured, you don't have to worry about the cover you require because we pay for it. Now, I think, unfortunately, there's a lot of myths and misinformation. Now, just to give you an idea, there's a huge number of saying there's a huge amount of out-of-pockets, but I can tell you across the globe, our out-of-pocket payments in South Africa is about 5.5% of expenditure. It's one of the lowest across the globe in terms of out-of-pockets. And partly because, we're based on the solidarity principle. We have a package, we cover for PMBs, etc. Unfortunately, why we've got escalations in the years and increase in contributions is partly due to incomplete regulatory framework from 20 years ago. So that compounded with some other effects has resulted in medical schemes increasing costs, well above, in advance of salary inflation.
I can just see people arguing with you, the nation, but I hear you. I mean, I realize they're not for profit, but there's big building in Sandton people point to, the one, things like that. I mean, people just get a sense that actually it's not working out for them.
Yeah.
There's a lot of politics to this. And my own sense of the politics is that both the DA and the ANC quite like the NHI issue. So they're actually very happy to keep it in court for a while. It's good for both their voters. It gives them something to argue about. The problem for your industry is that there's no clarity for quite a long time.
Yes. I think fundamentally, and that's our biggest concern, I think it was previously raised, there's two roads. There's the high road and the low road. The high road is, work with the private sector, because the private sector, besides supporting universal health coverage, has all the skills, the knowledge regarding, healthcare insurance. We have the expertise having done so. But unfortunately, we're going the low road, which means all the route to universal healthcare coverage in the way the Act is defined is probably going to take us 5 to 10 years, because we're going to be spending tons of money and effort through the court systems trying to find who is right, in terms of this. And unfortunately, we could have been using this time progressively to figure out what are the constructive ways to enable this in a more sustainable and financially viable way.
Thoneshan Naidoo, thanks very much indeed, CEO of the Health Funders Association. Do appreciate it. I'd like to hear from you tonight how you feel about your medical aid. I mean, I realize not everybody feels ripped off, but I think many people do. I mean, one of the problems with medical aid is that it is very difficult to understand. It's almost as bad as a cell phone contract. You start to read the fine print and you actually need to sit down for quite a long time just to recover. And I realize that medical insurance is, just by the nature of it, a complex and technical thing. I suppose in some ways there will be people, and I recently bumped into someone who said something had happened to their partner, do very bad things in succession, and it virtually cost them nothing. You hear from other people who just feel they've been throwing money down the drain. Your view?